Imagine you are navigating a winding path to better health with diabetes. Every step is important, and one of the most critical is ensuring your insulin dose is perfect. Do you ever wonder if you are truly getting the precise amount you need with each injection? Loading an insulin syringe correctly is a fundamental skill that directly impacts your blood sugar management. It ensures that you administer the exact dose prescribed by your healthcare provider, which is vital for maintaining steady blood glucose levels and preventing complications. The core idea is to carefully measure and prepare your insulin to avoid any under- or overdosing. The reason this precision is so important is simple. Insulin is a powerful medication, and even small deviations can have significant effects. Too little insulin can lead to high blood sugar, known as hyperglycemia, while too much can cause dangerously low blood sugar or hypoglycemia. Each scenario can be serious, so accuracy is not just a suggestion, it is a medical necessity. Proper technique minimizes waste and maximizes the effectiveness of your treatment plan. Let's walk through the steps to load an insulin syringe accurately. First, gather all your supplies: a new sterile insulin syringe, your insulin vial, and an alcohol swab. Always begin by washing your hands thoroughly with soap and water to prevent infection. Next, inspect your insulin. Check the expiration date and ensure the type of insulin is correct. Clear insulin should appear clear. If you use cloudy insulin, gently roll the vial between your palms 10 times to mix it evenly. Do not shake it, as this can create air bubbles and denature the insulin. Now prepare the vial. Wipe the rubber stopper of your insulin vial with an alcohol swab and let it air dry completely. This keeps the insulin sterile. Pick up your syringe and pull back the plunger to draw air into the syringe, matching the number of units you need for your dose. This step is key. Carefully insert the needle through the center of the rubber stopper into the vial. Then, push the plunger to inject all that air into the vial. Keeping the needle in the vial, turn the vial and syringe upside down. Make sure the tip of the needle is submerged in the insulin. Slowly pull the plunger back past the mark for your prescribed dose by a few units. This gives you a little extra to work with. Before removing the syringe, check for any large air bubbles in the syringe. If you see any, gently tap the side of the syringe with your finger to make them rise to the top, then slowly push the plunger to releases them back into the vial. Pull the plunger back again to re-measure if needed. Finally, adjust the plunger until the top edge aligns precisely with your prescribed dose. Double-check that there are no air bubbles remaining. Carefully remove the syringe from the vial, being sure not to touch the needle. If you are not injecting immediately, carefully replace the needle cap to maintain sterility. If you are mixing two types of insulin, your healthcare provider will give you specific instructions for that process, which typically involves drawing up the clear insulin first, then the cloudy. Mastering this technique gives you a true sense of control over your diabetes management. It ensures that every injection delivers exactly what is needed, supporting stable blood sugar and peace of mind. By taking a few extra moments to follow these precise steps, you are actively contributing to your long-term health and well-being. You are empowered to manage your diabetes effectively, confidently, and safely every single day.